Good morning. This is Joyce Coleman. I am the Executive Director of the Vasculitis Foundation, and I would like to welcome you to the 2014 Roadmap to Wellness series. The goal of our webinar series is to educate our patients and family members about vasculitis. During today's session, if you have a question, please take advantage of the question feature in GoToWebinar, and we will address as many as possible at the end of the presentation. We encourage you to keep your questions general and not specific to your own case. Today's webinar is being recorded and will be made available for future download and playback. Our speaker today is Dr. Ronald Falk, the Alan Brewster Distinguished Professor of Medicine at the University of North Carolina, Chapel Hill. Dr. Falk is the Chief of the UNC Division of Nephrology and Hypertension and is also the co-founder and director of the UNC Kidney Center. He is a longtime VF medical consultant and member of our scientific advisory board. Dr. Falk has been instrumental in helping the VF achieve its mission of raising awareness, educating our community, and funding innovative research. Dr. Falk's research probes questions focused on immune-mediated kidney diseases, especially glomerulonephritis. His clinical and basic science interests include both ANCA and small vessel vasculitis. A central objective of Dr. Falk's research is elucidating the causes of ANCA necrotizing and crescentic glomerulonephritis. Dr. Falk conceptualizes this process as opening the vasculitis lock with a key that has a number of ridges and valleys analogous to those factors that contribute to the development of the autoimmune disease. Dr. Falk participates in a research group that, in a large study over the last 4 years, has revealed a number of avenues of investigation and new approaches to ongoing questions that pertain not only to ANCA glomerulonephritis, but to the general fields of autoimmunity, inflammation, and basic neutrophil and monocyte biology. At this time, I'd like to welcome Dr. Falk to the webinar and turn the session over to him. Thanks, Dr. Falk.
Joyce, thank you so much for that most kind introduction. Welcome to all of you who are listening. And from a more practical perspective, I'll tell you that most Thursdays of my life, I have the privilege of seeing many patients with vasculitis of one kind or the other and autoimmune diseases. As a matter of fact, as you may hear from my voice, I'm an older human who's probably now seen well over several thousand patients with autoimmune diseases and vasculitis in particular. And it is from that experience that I wish to have our discussion today about communication between physicians and patients. So let's get started here with the basic discussion point today of how is it best to communicate with your doctor. And in my view, the questions are really in the answer. A number of years ago, there was a beautiful description of this interaction. Medicine is an art whose magic and creative ability have long been recognized as residing in the interpersonal aspects of the patient-physician relationship. And it is then that relationship that I want us to talk about. This slide really depicts on one end of the spectrum the lack of communication. Look at what on the left side of this slide, what the patient is thinking. What did he tell me to do? My questions can wait. He looks busy today. He doesn't need to know I do acupuncture. And oh, by the way, nah, I'm sure these aren't flu symptoms. They'll probably clear up. His spouse is saying, why can't we afford the medicines we need, smiling away. And the physician is saying, I love patients that do what I ask them. The ANCA titer's going up. Not sure what to do here. No questions, so he must have understood everything I told him. I hope at the end of this webinar, this kind of interaction completely is dissipated. So the very best medical care happens with good communication. And a good doctor-patient relationship includes mutual trust, respect, and good communication. And saying in a third way, in healthcare, good communication provides the best outcome with the least number of mistakes. And that's where we really must focus. What is best for you as a patient population in general and as an individual, hoping for the least possible adverse outcomes or errors. So in my mind, good communications includes a laundry list of things. Listening to your provider. And, oh, by the way, on the other side of that, feeling listened to and understood. Did my provider really understand what I am trying to tell him? It's important to focus on specific issues. What are the main issues that I want my provider to hear today? And avoiding veering away from your main concern. There must be mutual respect, for mutual respect allows one to engage in a dialogue. It's very important to be ultimately honest, and we'll talk more about that in a minute. It's important to tell those issues that really are your biggest fears, your biggest hopes. What are you expecting? What is it that you want from your provider? It's important that everybody speaks the same language, including avoiding medical jargon or words that in your own mind you think you understand, aren't quite sure, but think that that would help discussing issues with your doctor. And, oh, by the way, if your physician uses medical jargon, you should prod that person immediately and say, no, 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 tell me what that means. And finally, it's important to ask questions. Let's talk for a moment about being honest. It seems like at the very base of any good communication. But I think for the most part, what I'm more concerned is that people aren't actually honest with themselves. They're not honest necessarily with their symptoms. Are we really going to tell ourselves, and oh, by the way, our provider, what's really worrying us and bothering us, or our bad habits or side effects of medication? I will tell you that physicians make terrible, terrible patients. They're the ones who usually have stopped their medications and don't say anything. That's a bad idea. If medications are causing side effects, it's really important to know. And have you followed up on all the recommended tests and appointments? And if not, be honest about why not. Be upfront, in other words. And you can tell from my little cartoon on the left, I don't think you're telling me all your true symptoms. So Dr. Leo and I are going to play good doc and bad doc to get all of the info. Let's try to avoid that. By very nature of the autoimmune disease that many of you have, vasculitis, that's a scary phenomenon. I think patients always want to know a series of questions. What causes my disease? What's the name of my disease? How is it going to get better? How is it going to get worse? But there is underlying a lot of those questions a deep-seated fear. Gee, doc, I'm scared. If there is something about your health that is scaring you, bring it up. List your symptoms. Explain why you're afraid, and enter into a conversation. And part of this fear actually makes it so that you may downplay your symptoms. I'm afraid my doctor will think I'm crying wolf if I call wolf or lamb. In other words, let me translate this. Let's say you have sinus disease. Is it garden variety sinusitis or an upper respiratory tract infection because it's a usual infection because everybody in my household has had that infection, or is it that my disease is coming back? And how do I tell? And if I tell my physician that I think it's my disease coming back, will he think I'm calling wolf? It's remarkably easy close up to tell a wolf from a lamb, but let your physician be the judge. Take the wolf to your doctor and see if it really is a wolf. The more pertinent information a patient brings to the physician, the better off both of them are. Quotation from Dr. George Sheehan. Be honest and tell physicians about what complementary and alternative health practices you do. And there are a whole series of them that you see here. It turns out that we all know that people, all of us, do these various alternative forms of therapy. Did you know that 40% of Americans use some form of complementary health practice? And people 50 to 59 are the most likely to report use. You'd think it would be a younger group, but it really is not. In fact, there was a survey a few years ago of individuals 50 or of people 50 or older. Over half of them say that they report the use of some complementary health practice and that they've discussed them with a healthcare provider. And in fact, Dr. McGregor in our own practice studied the use of complementary and alternative medicine by patients with vasculitis. 81% of them say they use some form of alternative approach, including prayer or exercise or massage therapy or acupuncture or mind and body practices. And almost everybody thinks if they do them that they're very helpful. Discuss complementary and alternative medicine with your physician. And don't be shy about it. When you complete a patient history form, tell us what you're doing. Make that list ahead of time. Tell your healthcare provider about all the therapies, all the over-the-counter prescription medicine, dietary, and yes, all the herbal supplements. Don't wait to be asked. Be proactive. Don't be shy. And considering a new complementary health practice, ask your doctor about whether they think it's safe, effective, and if there are interactions with your current medications. Let's deal with this other issue that we must talk about. I'm afraid to ask for a second opinion. Boy, second opinions are a great way to learn about your options. They're one of your most important rights. About being able to get a second opinion about your diagnosis. Being informed is critical. 1/3 of adults in the United States will never seek a second opinion. Almost 1/10 of newly diagnosed patients rarely or never understand their diagnosis. A second opinion means you're consulting with another doctor to confirm a diagnosis, find different treatment options available to you. And how do you do it? Most of us actually encourage second or even third opinions. You can ask your friends, you can get a list of approved doctors, you can contact your local medical society, but we in the vasculitis environment really have a wonderful option to figure out where help may be from the Vasculitis Clinical Research Consortium and, of course, from this support group itself. What you need when you go, you need your records. You need to make sure you have specific questions that you want to ask. And bring a pad and a pen to write them down. Just as importantly, bring an advocate with you, somebody who goes to that second opinion, who listens and helps you return back to the primary doctor so that they understand what the second consulting opinion has to say. I'm worried about cost. That's another issue that people don't like to talk about. If you have financial concerns, talk to your physician about it. There may be many less expensive alternatives. And we as providers have other options available to assist you with medical costs. So if financial issues may interfere with following through on your medical treatment, please, please let us know. Ask questions. Demand clarity. I don't know why you want me to take this medication or undergo a specific treatment. Can you go over that issue with me once more? Please speak up. Don't be afraid or embarrassed to talk about your health concerns. Your doctor needs all the information to best help you, and you need all the information that you can gather. So before your visit, organize yourself. Put down the symptoms or questions as soon as they arise, and keep that list handy. You're going to forget them when you come to see us, but have that list available. And don't have vague questions. Try to make them as specific as possible. Identify the goals for the visit. What do you want to accomplish? Prioritize those goals, 1 through 3, 1 through 10. Which ones do you really want answered before you run out of time? So on those notes, make sure you have your current meds, prescriptions, over-the-counter, herbal supplements, and vitamins. List the summary of your medical history. Rank the conditions of importance to you and give dates when you can. Did you get tests elsewhere? Make sure you have copies that you have for your own files. Are there changes in symptoms since you last came? Do you need refills? Do you need forms to be completed? Come to your physician's office organized as best as you can. At the doctor's office, speak up. Being part of the team requires trust and clear talk. Be frank even if it's embarrassing. Hand your doctor your list of what you want to discuss. Voice your ideas. Ask questions when they arise. Talk much with your doctor? See those Band-Aids over the mouth? Don't do that. You have the right to remain silent. Oh, but please, please don't. So at the doctor's office, clarify. And if you need to, bring a buddy, bring a family member to take notes or keep track of questions or record your visit. How will that help me? Well, it will help me if the advocate sitting there clarifies the question and reminds you of all the things that you forgot when you were sitting in the office. Ask the question, what will happen if I don't do what you've just suggested? Is there a consequence? And then a common issue. What do you mean by come back if I'm not better? What does that mean? In a day? A week? A month? How much better? A little better? Completely well? So clarify, physician, what do you mean come back if I'm not better? How much better? And have that discussion with your provider. Negotiate. It's fine to negotiate. Request a cheaper drug or one with fewer side effects if that's available. Ask for an easier regimen or a less painful procedure. If a suggestion is unrealistic, don't sit there. Say, what you're asking me to do, I can't do. It's okay to think about your decision. It's okay to change your mind. Use your time wisely. Your appointment is limited. Plan your questions. Make sure you have your 3 most important questions responded to. So if you ask too much, if you have too long of a list, or you tell too much, there may, in fact, be a discord between you and your provider. So you have the right to understand your diagnosis, your symptoms, your tests, your procedures, the risks and the options. Your doctor has the responsibility of treating you with respect, listening to you, answering your questions, educating you, and considering your opinions and your concerns. You are responsible for coming to the scheduled appointment, taking your meds, reporting adverse effects, understanding your disorder, and telling your doctor about symptoms, progress, questions, and concerns. So how do I communicate with my doctor when I'm not there? An email raises the issue of HIPAA compliance, so secure messaging for physicians and healthcare networks is important. There are many patient portals now. We have one now, and those people who are going on national electronic healthcare systems such as Epic or Cerna will have the opportunity through various portals to immediately get in contact with their physician. The awkward moment when Mr. Kang realized that his nephrologist didn't think of him as a whole person. Boy, try everything you can to make sure that the patient and doctor relationship is a holistic one. We must make sure we think of you not just from the perspective of vasculitis, but as a whole individual, a whole being, trying to do as best as you can with the disease that you have. So here's my final food for thought. Your relationship with your doctor is one of the most important ones in your life. In sickness and in health, I listen to that when I go to weddings. This is a most important time to have that relationship with your spouse and, quite frankly, with your physician. Your doctor should be there for you through all of it, to cross bridges and valleys of your disease. The better you communicate with each other, the better we can care for each other and the doctor can help provide for you. So Joyce wanted me to have this disclaimer. No, I have no conflict of interest. I'm not promoting or recommending websites or other publications, nor do I own some of the media presented. And now it's time for questions. And thank you, the Vasculitis Foundation, for putting on this webinar. And the final slide, join now, the phone number, and how you can get a hold of the Vasculitis Foundation that has done so much for patient awareness, education, support, and research. So let me stop there.
Great, Dr. Falk, thank you so much. We have received quite a few questions from the audience, so I will start with one. So one of the attendees asked, with 8 doctors and 2 main lead doctors, what's the best way to keep them all updated without bogging them down? Would a 1-month, maybe a 1-page monthly summary work? Do you have any suggestions?
Try, if possible, to find places that have an organized approach to multidisciplinary practice, so the physicians are organized themselves. If that's not available, then you may have 8 doctors and 2 main lead ones. I think here, having a file that has communication, the physician visits, the lab and other x-ray findings with you, so that when you see the physician or multiple physicians, they can have access to all of these various reports from you, turns out to be an incredibly effective tool, a tool for communication. I have received emails and letters from patients that see multiple providers, and to a certain extent that's very helpful. But the clarity moment occurs when I'm seeing the patient, they've seen multiple other providers, and the patient and their advocate can help me fill in all those other visits at the time when I'm seeing them face-to-face. That's a really effective approach.
Great, thank you. Another question, someone asked, can you please address the challenge of when a patient has to make a visit to an emergency room? Are there proactive things the patient can do in case this happens? Because they may be dealing with 1 or more physicians who are not familiar with vasculitis.
Emergency rooms are worrisome places. They're worrisome for patients, and they're worrisome for physicians. When you go to an emergency room, bring as much information as you can, that patient file that you've been collecting, so that the emergency room physician knows what you have, what your diagnosis is, what medications you're on, and what problems you have had. That's a great way of educating the emergency room physician as quickly as possible. Try to get hold of your primary care provider before or as you're going to the emergency room. Make sure that your primary care provider knows you're on the way, so that if they're available, or whoever is covering for them is available, knows that you're going to the emergency room and that they can help with the emergency room as well. Ask questions in the emergency room and try to get as much care as you can with as few tests as possible, so that you can limit the potential trouble that may ensue in any emergency room in our country.
Great, thanks. The next question is, how do you recommend working with a doctor who treats your disease well, but is not open to discussion about new therapies you might be curious about? Not random internet medicine, but research you have heard about from the VF. Thank you.
All of us are very concerned about information that's available on the internet that quite frankly may or may not have any basis in reality or truth. Information from reliable sources such as the Vasculitis Foundation is information that has passed through the filters of expert opinion. As such, it's really important for whomever is taking care of you to at least be able to discuss those options with you. If a physician is unwilling to do so, that's a wonderful opportunity to seek a second opinion.
Great, thank you. Another question, what advice do you have when doctors disagree? For example, on a prednisone taper schedule, or how often to do infusions of IVIG or Rituxan?
So with respect to rituximab, the international community has not settled on an organized approach, although I think most of us have data that would suggest that regardless of whether you get it once a week for 4 consecutive weeks or 14 days apart, the results are going to be the same. I think the issue with rituximab going forward is how little total dose can one get away with and go into remission from a relapse or as part of induction therapy. So there's lack of clarity of the international community on the best approach here, and so it is not unexpected that there could be differences with respect to what a patient is hearing from multiple physicians. Getting the physicians to interact to solve that question is one on a practical basis that needs to happen. Prednisone tapering is similarly something that is not uniform, and as a consequence, again, there are going to be differences of an approach. But here you as a patient must participate. Prednisone has as many side effects as any medication around. The total dose that you're on, how quickly you can come off, may have much to do with how you as an individual think you're doing with respect to the positive effects of prednisone versus its side effects. I will tell you my most experienced patients, ones who I have taken care of for decades, are the most proactive in informing me how they plan to take their prednisone and very much participate in the prednisone taper. This is where the patient's input is incredibly important. The most experienced patients taper themselves with their physicians in the best possible way. Physicians who don't listen to patients about their desires in this regard really need a good, honest communication back and forth.
Great, thanks. Okay, the next question. So we've been discussing patients and physician communication, but here's a question. What's the best way to get family support for a patient with vasculitis when the symptoms are not always apparent and the family assumes the patient is cured?
Oh, that's a fantastic question. Family support, spousal support, significant other support, child support, parent support is critical in the long-term outcome of patients with any autoimmune disease. And I think that relationship between the patient and the family member is one that goes through all stages of any kind of relationship, from fear to anger to guilt to patience to impatience to understanding to lack of understanding. And this is a discussion that must occur between the patient and the family member, but one that absolutely can occur with the patient, the family member who comes with them, and the physician. So often, however, I have asked the patient and their family member to really get external counseling. As a matter of fact, when I start seeing patients for the first time, I encourage them to get counseling, for there's no question that an autoimmune disease that comes and goes has a real psychological toll on the patient and on the family member. So I encourage counseling by the patient, by the family member, and even more importantly, by both at the same time, with any number of types of providers, clergy, psychologists, psychiatrists, social workers, somebody who's professionally trained, in other words, to really get help in bridging what could be a divide between the patient and the family. This is something that physicians, however, really need to bring up and talk about. And so patients need to bring it up and talk about it with their physician present. Family support is absolutely critical to how well patients do. To a certain extent, a patient with vasculitis results in a family with vasculitis. A patient with an autoimmune disease means the family has that autoimmune disease. And the ups and downs there of what the patient goes through are very similarly matched by what the family member goes through. And the family member may say, okay, your disease is over with now, because I, as the family member, am exhausted. And the patient says, but I know I'm still fatigued. I can hardly get away without a nap. That's a conversation that must occur, and must occur if need be, with the provider and the family member all together. A critical question, and one that really must come up and has to be solved.
Thank you. Here's a question. It's a little bit more medical, but I'll ask it anyway. Is myositis a result of vasculitis or a disease of its own?
Myositis, anything in medicine with a suffix itis, means it's inflammation. Myositis means there's inflammation of muscle. And inflammation of muscle can be caused by, just imagine the list of things that can cause muscle inflammation, from diseases that affect the muscle, to trauma, to vasculitis, to the drugs. The most common medicine that actually hurts muscle may be lipid-lowering drugs that one can be on for any number of reasons, or the interaction of drugs. Myositis, or muscle aches and pains, are common and have multiple causes.
Thank you. Here's another question. My rheumatologist refuses to discuss the neuropathy issues I am experiencing. He says I must talk with the neurologist. Is there some way, is this normal? Is this communication? You know, do you have any, and I know this is pretty focused on one person, but I think a lot of our patients have communication issues like this. Do you have any suggestions?
Yeah, I mean, this is in specific an issue, and in general, really harkens back to a question that already has come up. So let's talk about this physician-physician interaction. So one of the questions that has to be asked is the neuropathy in this case part and parcel of the vasculitis? It surely could be. Is it part and parcel of the medication? It surely could be. And as a consequence, is it part and parcel of my vasculitis? It surely could be. And if it is, then whoever is taking care of the vasculitis, whether it's a rheumatologist, a pulmonologist, a nephrologist, an ear, nose, and throat person, that individual has to help you deal with that problem, unless they're really not capable of doing so. In other words, that it's outside of their expertise. At that point, then you need to have help by another physician, and in this case, a neurologist may really help. I would encourage, however, all of you to have a primary care provider, somebody who is the quarterback for whatever problems you may have. Now, it may be that your kidney physician or your rheumatologist is very willing to be your primary care quarterback, that they'll take care of all of your ills of one kind or the other. And if they are willing to assume that role, well, then you're in luck. And in fact, then you can ask and should expect an answer to all of these various questions from that particular provider. But I will tell you, in my own practice, I really encourage patients to have somebody who lives locally with them, who they respect, and who's willing to communicate, a primary care internist or family practitioner who really is able to deal with all of the various ills that a patient may have, in addition to their vasculitis, and that they're willing to be trained and think about how vasculitis may impact other kinds of disease. So let's think for a moment about why a neurologist may be useful. Let's say for a moment that the neuropathy is due to diabetes and not due to vasculitis, although the vasculitic therapy, the prednisone, may have led to diabetes. here the question is, who should really take primary hold of that problem? It probably isn't the rheumatologist. It may not be a neurologist. It could be a diabetes expert, or again, it could be a primary care provider. I would assume that if a rheumatologist didn't feel comfortable with the neuropathy and said you must go to a neurologist, that I would heed that warning. I would say, okay, my rheumatologist really doesn't feel comfortable taking care of my neuropathy. Where can I get help? And here the help, more than likely, would come from a good internist or, if need be, a neurologist. Every patient needs to ask, who's the quarterback? Who is the main person who's going to take care of me, regardless if it's a vasculitis problem or some unrelated disease? Very important to have that person. But in fact, it could be your nephrologist or it could be your rheumatologist who's willing to be the quarterback. And then, of course, that allows you to have one person who helps you with all these various issues.
Thank you. The next question is, can you give tips to parents of young adults / older children for continued care and helping with the parent-child to transition to adult patient care? So I think we're talking about as they...
Transition.
Yes.
I got it.
Okay.
Transition from parent, from being an adolescent or a young adult to being an independent individual. And that transition of care is something that we have thought about in all disciplines. The transition of care occurs with any disease. You name the disease, whether it's vasculitis or kidney disease or lung disease or heart disease. If a child or an adolescent has that disease, the parent has to have been the person who, for all of the parental reasons that you can imagine, has been worried, fearful, concerned about the child, the adolescent, the young adult. That worry does not go away the moment the patient becomes 21. That fear persists, and it's incredibly hard for the parent to let go and let the child, now young adult, metamorphosize from caterpillar to butterfly. That process of transition requires communication between the patient, the parent, in the setting of a provider, a physician, or perhaps a nurse who really is experienced with this. There's also an onus on the adolescent to now really take responsibility as an adult for their disease process. And the way that that slips backwards is when the adolescent, now young adult, behaves more as an adolescent than young adult, and the parent feels like they need to step back in. But that transition is one that needs really to be carefully orchestrated so that during that transition, the disease process does not cause harm. So communication, communication, communication. Parent, transitioning child to adult, and physician. That's a conversation that all three parties need to have together.
Thanks. The next question is, does not having an advance directive negatively impact the patient-physician relationship?
And no, it should not have any impact whatsoever. An advance directive is something that is important if you feel as a patient that that's important for you to have. Advance directives are very helpful to make sure that providers who are not familiar with you, in other words, emergency rooms or hospitals, that they do what you're really hoping is the care that you imagined that you're going to receive, and that that actually happens. So advance directives are incredibly useful for people who don't know you, but they're also very useful for your own main physicians to understand what your wishes are and to have those wishes carefully communicated to your physician and, in fact, have it as an advance directive. But no, there should be no requirement, no change in the physician-patient relation on the basis of having or not having an advance directive.
Okay, great. So the next question, I'm combining two questions. One person asked about worst case scenario, what if I need to get a new doctor? And another patient or attendee asked, how do you end a relationship with the doctor if it's simply just not working? So can you kind of work on those two questions together, please?
Be honest. Be honest with yourself and be honest with the physician. Dear physician, I know you've tried very hard. You've been really straightforward with me, but I need to have a different approach for me. Please don't take this personally. This is something that I, as a patient, feel is important to me. Thank you for everything you've done for me, but now I feel like for my own best interest as a patient, I need to seek care elsewhere. I perhaps will come back because you have really provided me with good service. But for now, I need to try another approach. I think all providers, all physicians, should easily be able to swallow that one.
Okay. The next question, an attendee asked about, she supports her 22-year-old daughter in the use of complementary medicine, but the physicians have not been very receptive to it. Do you see that changing? I know UNC has a great, you all have an interest in complementary medicine. Do you see that changing in medical schools? What do you see for the future?
I think it better change, since the reality is that most experienced patients use complementary and alternative approaches, and I gave you a list of some of those. I think that in medical schools, greater acceptance to complementary and alternative medicine holds sway. I think that most physicians, as we're growing up, I'm a happy, almost 62-year-old physician, I think we've all understood that there's an important role. I do think that patients need to listen, however. There's some herbal supplements that are flat out dangerous. There are some things that physicians are nervous about with good reason. So there are some complementary and alternative medicine strategies that are dangerous. And so that communication structure is really, really important. So I will tell you I'm very much for complementary and alternative medicine. My patients will tell you that so many of them use it. But I am worried about certain kinds, and I do really not want patients to do them because I think that they're unregulated. Some of them are unregulated and could cause harm. So that communication of what patients are doing is important to the physician. If the physician says, you really shouldn't do acupuncture because it's bad for you, if you're going to somebody who does acupuncture and the needles have been sterilized, I think the chances from somebody who really knows how to do it, I think the chances of it causing harm are very tiny. And the possibility of it helping for pain may be pretty good. So I think that patients who really say that prayer helps, if it helps them, that's great. And the physician needs to be sensitive to that. If somebody thinks massage therapy helps, specific supplements help, that communication is a two-way street. The physician needs to listen and to adapt, but please, as patients, if there's potential danger, please listen to that danger as well.
Right, absolutely. So this will be the last question. Unfortunately, we're running out of time, but you talked earlier about having a quarterback on the team to lead the physicians. So one of the patients asked, but how do you how do you help your physician realize that you're one of the team players, so that it's a team effort, the patients on the team too?
Be honest. Communicate. Hi, this is my disease. I'm doing the best I can to take care of myself. thank you, physician, for all of your help. But I also get to and must be part of this relationship. Remember, physician, that the patient-physician relationship is a team. It requires teamwork from everybody. Thank you so much for being part of my team. But I have other members of my team as well, and I need to make sure I communicate with them. But thank you so much for being the wide receiver. My quarterback is Dr. X, who's my internist. You are the quarterback, Dr. Y, for my vasculitis care. And I feel comfortable with my internist and my vasculitis doctor. I hope you two communicate. I'm going to help communicate for you. But, oh, by the way, I, as the patient, am an integral part of this team. And so, by the way, is my family member.
Great. Dr. Falk, I would like to thank you. As one of the attendees just commented, Dr. Falk rocks. So I just want to thank you for participating in this webinar. And I wanted to mention to the attendees that on the UNC Kidney Center website, they have a great collection of podcasts that Dr. Falk and some of his colleagues have put together. They're available on the kidney website, and just great informative podcasts.
Thanks, Joyce. And know that Diane Shaw was one of the, who's a former president of your organization, participated in those hugely.
Yes, probably. Yes, that's right. So thank you. I also wanted to remind people that if you are seeking out physicians, we do have our VF medical consultants and vasculitis centers around the United States, and also internationally we have doctors recognized that we can help you connect with. And then as a final reminder, I just wanted this webinar is the second in a series of webinars. Our next webinar will be held in May during Vasculitis Awareness Month, and we will be discussing advances in vasculitis research. We are always looking for feedback and suggestions on the webinars, so please feel free to contact us at the Vasculitis Foundation office. The email is vf@vasculitisfoundation.org. I wanted to thank everyone for participating, both Dr. Falk and all the attendees. Have a great day. Thank you.